Hi, my name's John. I am the practice manager and a nurse navigator with Navigate Wellness. Prior to working for Navigate Wellness, I worked in the inpatient side of healthcare in the emergency department and spent several years in cardiac care. And we're going to talk in a series about cardiac care management. This holiday season, we want to make you aware of something called holiday heart syndrome. Holidays can bring on a lot of stress, a lot of big meals. Maybe you're consuming more alcohol. There's a lot of people in the house, and sometimes this can add a lot of stress to your heart. Sometimes all of these factors taken together can make your heart feel like they're skipping a beat, and sometimes these heartbeats can lead into even more skip beats. May lead into a condition called atrial fibrillation, something that you may have heard called AFib. Holiday heart can also present with symptoms like shortness of breath, increased fatigue. Things that used to be easy, like walking up the stairs, may make you feel out of breath or more fatigued than you've been in the past. Here's some things that we would like you to know about a condition called atrial fibrillation. You may have heard it called AFib. AFib is where the top part of your heart sits and quivers. So anytime you hear the word fibrillation, think quivering. The reason that this is bad is because the job of the top part of your heart is to squeeze blood into the bottom half of your heart. And when it shakes and quivers like that, that blood just tends to sit there and pool. Now this blood, whenever it pools, it makes tiny little blood clots. And those blood clots can go into blood vessels in your heart and also travel to your brain, causing a stroke. So we'll talk about something that sounds really scary, a heart attack. Now, a heart attack doesn't always mean that your heart has stopped. What a heart attack usually means is that there is a blockage in one of the blood vessels that supplies blood to the actual muscle of your heart. There are some things that you can do that are very simple to help you with your cardiac care management. One, you can change your diet. You can exercise. Absolutely follow your physician's orders. Take the medications that you're supposed to. And if you smoke, please stop. Hypertension and cardiovascular care are really two sides of the same coin in this, that your blood vessels are hooked up to your heart, and when you have something called high blood pressure or hypertension, that can be really dangerous. Some of the common symptoms of hypertension or high blood pressure will be headache or blurry vision is one of the things that happens commonly. Left untreated, hypertension can lead to other problems like damaging your kidneys or even leading to a stroke.
We know that hospitals do their best to try to get patients home.
Sometimes the hospitals are on not minimal staffing, but reduced staffing because the hospitals do their best to get staff home for the holidays to be with their families.
It creates a unique situation where with staffing changes being different and discharge plans operating a little quicker or longer depending on the holiday window, it can make discharge look and feel different than your typical discharge. Normally they regiment this stuff out, it's like your doctor's gonna call you on you're gonna have a follow-up appointment, all this stuff. But with the holidays, all the scheduling and stuff is.
Yeah, sometimes the holidays will throw a road bump or a speed bump into something that's already kind of a chaotic process. And I think that's part of our job is to figure that out and figure out the best way to get people home, the best time to get people home. What is the support network that people have at home that they can go home to?
Because we work holidays, and
Right.
weekends and nights. And you can
Right.
always get a hold of us. Any good nurse is going to tell you that we are supposed to start planning discharge the day that a patient walks in on admission.
That the normal person, the average person, hears about 30% of the things that you tell them. And in a stressful situation, like a hospital discharge where they're being discharged home, to rehab, a nursing home, you hear even less.
We know what your goals of care are. We know we understand what your medical team is saying.
Right.
We're going to take that plan with us as you go home, and we're going to be with you the whole way.
So when you're in the hospital and you're getting these discharge instructions, you as a caregiver that may not know how to speak the healthcare language, it's like taking a drink from the fire hose, and you get a lot of things from that. Some things you miss, some things you get. But that's our job. That's why we Navigate Wellness, that's why we walk through this with you, so that we hear those things and we know those things and we know what to look for to keep you out of the hospital. A lot of people that get discharged from the hospital come back in within 30 days, 90 days. A lot of that is because sometimes they didn't hear that critical part of that discharge instruction.
Cardiac care management involves a lot of different factors, and there's a lot of things that you can do to help your heart out. Some things that are very simple. Heart health boils down to just a very few simple things. One, if you smoke, stop. If you don't smoke, please don't start. If you don't follow a good diet, you should follow a good diet. You should exercise. You should follow your doctor's orders, and you should take your medications as prescribed. And we know that trying to follow these lifestyle choices can be very difficult in this. But if you don't follow these, then it can lead to hardening of your arteries, which impacts your cardiac health.